Yes, my friends, everyone in the chat, and good morning, good evening, good afternoon. Or someone has died now is sleeping. Let me tell you that's what good. So, let me get to invite everyone in the channel. Let me get to say welcome to the channel of Dr. Benjamin, the wise guy. I can see Jamaican uncle is here, and everyone who is gonna come again to the channel. Everyone, be blessed when you're coming in. Here we talk about great issues like which ones? We talk about good issues like health matters. Sometimes people tend to think, good morning, Dr. Ben, in the live stream. Thank you, Jamaican Uncle, for tuning in. Some people tend to think that when you talk about medical issues, it only says that you are sick and you need medical attention. No, I want to tell you that no. When you are getting a medical advice, getting some advices from some people about medical issues, it doesn't mean that you are sick. It doesn't mean that you are sick. There is something that is called preventive medicine, types of medicine, and mental health. You see, those are things that you just need to listen to some content or visit a doctor's office to discuss issues concerning some things. Preventive medicine is a very particular type of medicine that when you go through preventive medicine, before we go to tension type medicine, let me give an overview of preventive medicine. I can see some people are here. Welcome everyone to the channel. You are watching Dr. Benjamin here, and I give medical tips. And if you are new to the channel, tell me where you are watching me from. Come to the chat, tell me where you are watching from, and tell us something. Don't just swipe away. It is good to tell us where you are watching from. I can see Goofy Nico said hi. Hi Goofy, which country are you watching from? Thanks for tuning in. Stay here until subscribe and like the live stream. Subscribe and like the live stream. Let's get to grow together. Indonesia, wow! You're the first person I have in Indonesia. So bring more people here. So I was telling people when we talk about I like and subscribe. Thank you so much. Thank you so much, Goofy Nico. I like talking about some medical issues, and I say when we are talking about medical issues, we don't just talk about diseases. No, we talk about Nene and Mom. Doc, how are you? It's been long. Yeah, Nene and Mom. Hope you are doing good. But when I see you online, I usually come. When I'm busy, I hit watch, and then I leave my phone there, and I continue watching in the background, even if I've not texted. I like watching Nene and Mom. Sometimes you can be so tired to just leave your phone rolling and then you are doing your work, and I understand. So welcome everyone. Goofy Nico from Indonesia, our new friend. Welcome to the chat. Nene and Mom, welcome to the chat, and thank you so much for always being my friend. And everyone who is watching, if you are watching right now, don't just swipe away. Come to the chat, tell us where you're watching from. Let's interact, let's get to know each other, or ask a medical question. Let's get to understand the medical facts. You see, so I was telling people think that when you see today, even I'm not putting on the work because some people get the phobia of seeing that thing. They start being sick, or they avoid coming online. So let me say this. You don't just listen to medical talks because you are sick and you need guidance. No, or you've been undergoing something and you need guidance. No, I was talking about some preventive medicine. We have different types of medicine. There is preventive medicine, there is a medicine for treatment, there is several types. So preventive medicine is a branch of medicine that focuses on the preventing a disease and promoting health and prolonging life rather than threatening the, preventive medicine. You are preventing something. So when you're coming to a channel like mine, you're coming here to prevent, not to get to a disease, to learn some tricks, not to get to a complication. So don't fear coming to a medical talk. If you have any question, here is where, and then we have something that is called Feel Good Friday, where we think about our mental health. We say what we think about life and social, social life. You understand that. So welcome. I'm still welcoming people in the group. I can see Goofy the goodie, Goofy Nico the goodie from Indonesia. You'll teach me which language do Indonesian speak? Which language? Indonesia has a language. Nende and Mom, big up, thanks for being here. Jamaican uncle, as always, thank you so much. And who is watching? You who is watching right now, don't just swipe away, man. Don't swipe away. Do what? Subscribe. You'll get some good informative talks here, and you'll feel nice when you are meeting my crew in the chat. Very humble guys, very good guys with good channels, and supportive guys when you need some support, when we need some health talks, when you need some mental health talks. My channel is the best. We have people like Jamaican Uncle, the Coffee Cakes, Nende and Mom. All of those people come here and we talk freely, and we try we talk social issues. So welcome to my channel. Don't go without subscribing. You who is watching, this is a good channel. You will receive notifications when I'm online and my people are here discussing some good and asking some questions. So I've said, when we're coming here and talk about some issues, the branch of medicine that I really like discussing, before I go to discuss the topic of the day, which is tension headaches, the branch of medicine that I really like discussing is called preventive medicine. Preventive medicine it entails preventing diseases before they occur, detect early a complication, reduce complications of a disease. Just listen to that. So this channel is a good channel. Some people may get to a place whereby you see this person has an impending problem. When I'm saying an impending problem, you note that this is a person that one day in life maybe can get hypertension. So when we discuss here, you start knowing the tricks of doing what? Of stopping that hypertension from coming, reducing disabilities, enhancing overall well-being to yourself. And also, when you have good health tips and health talks, your finances reduce, because you are not every time going to hospital spending on medical care. You see, you are not always spending on medical care. So your friends and everyone who is watching, big up every time, everywhere you are. And this channel always, I will really one day change the name to be called preventive medicine. Because we have 10 branches of 10 objectives of preventive medicine: prevent disease occurrence, detect early disease, reduce complications, promote health and lifestyle, improve quality of life, increase expectancy, not to die early. Some people, you may die early, man. You may die early because of not knowing what to do. Reduce disability, enhance overall well-being, protect community from outbreaks. Outbreaks are so bad. Ebola, COVID, dysentery, cholera, outbreaks, all those are on preventive medicine. The topic is headaches, but I'm talking about now the channel overall. So who is watching? Who is watching? Where are you watching from? We have a new friend today that is called Goofy Nico, the good, Nico the good here, a new friend from Indonesia. So let's talk about levels of, I'll just brush and go through them so fast. I'll just go through them so fast so that we can get to understand. We can get to understand these things. We have something that is called primordial prevention, prevents the development of risk factors themselves. And then we have primary prevention, like immunization when you are washing hands, using mosquito nets. Also secondary prevention, by screening if you have blood pressure, cervical cancer screening, HIV testing. Those are secondary prevention. And then we have tertiary prevention, physiotherapy after stroke, diabetic, food care, all of those, occupational therapy, all of those are prevention. We have quaternary prevention, avoiding unnecessary antibiotics, protects patients from unnecessary antibiotics and some rational drugs. And then we have components. We will talk, when we're talking about preventive medicine, it is long list of several things that we should talk a bit 1 or 2 hours, So welcome, who is in the chat, welcome, thanks for tuning in. Today we are talking about tension headache. And you see, we said we have several types of what? We have several types of primary headaches that they come themselves as a disease. You just have headaches and they have come themselves as a disease. Imagine, like migraines. And I know some people right now, you understand what migraines are. When you start having a headache every time in the afternoon, you will not be telling everyone that I have a migraine. You know what a migraine is right now, and why sometimes it hurts one side and not both sides, and why sometimes it can cause you to vomit. Types of headaches, migraines. Let's not talk about migraines when you don't understand the facts, but now understand the facts and know how to help some people out there. And I said we have primary headaches that are four types of primary headaches that are migraines, tension type headaches, the one that we are discussing today, cluster headaches, and other trigeminal autonomic cephalagia. That one is a very big topic, and you will find out that headaches are not just headaches at times. We are dealing with primary. We have not gone to the main one, which is secondary, because secondary headaches are the ones which are disturbing many people out here. Secondary headaches are the ones which are disturbing everyone out here. So who is there watching me? How do you feel? Where are you watching from? How do you feel about where you are? How is your day? Tell me. Interact with Dr. Ben. With Dr. Ben, how you are feeling. Tell me where you are watching from. Let's interact. Have you ever got chronic headaches? How did you handle the headaches? Because the first sign, let me tell you what takes people to hospitals. What takes people to hospitals? One is abdominal discomfort. I'm feeling discomfort in my abdomen. Second, headaches. I've been having a headache for 2 days and it's not subsiding. It's not getting down. So you go to hospital. You go to a hospital. So headaches are not just headaches. As we continue to learn about headaches, you understand that headaches are, or someone doesn't know what headaches are. Headaches are pain that comes from your head. Pain that comes from your head. So we saw that migraines are brought by something that is called trigeminal neural complications that produce some things like substance P, you see, and neurokinin A. Those things get inflammation to the head, and then you start, wherever that is disturbed, you start having headaches, vomiting. And then we say there are two types of migraines. Migraines without aura and migraines with aura. So migraines without aura, that one lasts for like 3 days. You don't have the vomiting. You are just it is, if you receive unilateral headache in one side for so long, you receive a headache for one side for so long. But migraines with aura, you can be watching, sometimes you lose vision, you start seeing blind spots, some light flashes. Those are the auras we are talking about. The migraines with auras, you see. So those are the things that we go through, and then we say that this is a migraine. This is a migraine because it involves all the cranial nerves. Sometimes you may have problems in speech, phonophobia, because all the 12 cranial nerves, let me repeat them. I like the 12 cranial nerves because they are the ones which are giving you all your sensations. They are the ones which are making you see. They are the ones which are making you talk. They are the ones which are making you have sensation on your face. They are the ones which are making your eyes, the 12 cranial nerves, to move. If you are watching, please appreciate the chat, like the chat, give a chat, and tell us where you are watching from. Tell us, I'm watching from the US, I'm watching from Africa, I'm watching from India, and let's get to know you. If you have a channel that is doing good work, don't fail to tell us, I have this channel that I do this and this and this. Let's promote all channels. Come in and tell us you have a channel. So who is watching? Where are you watching me from? Now, the 12 cranial nerves: olfactory, nose; optic, eye; oculomotor, eye muscle; oculomotor, trochlear, eye muscle; trigemina, what? We talked about trigemina, mastication and facial sensation, and even some eye movement. And then we have number 6, abducens. Yes, what does abducens do? Eye movement. After abducens, number 7, what do we have? Facial, tongue sensation, 2/3 of the tongue. Number 8, what do we say? That one was accessory. Yes, let me confirm, because accessory, it's not accessory. It's final accessory. No. Now, so welcome, my friends, everyone here. I can see some people watching. Yeah, I can see some people watching, and number 7, facial. Now, something we lost. Number 8, balance and hearing. It's called vestibulocochlear. Number 9, glossopharyngeal tongue, glossopharyngeal. So vestibulocochlear is number 8, hearing and balancing. And number 9, glossopharyngeal, the tongue movement. Vagus nerve is number 10. Remember, sympathetic system excited by the vagus nerve. And then we have accessory spinal, accessory neck movement and shoulder movement. And then we have hypoglossal. Hypoglossal. So if your cranial nerve number 10 does not move, you have a problem with your. So those ones come from the brain and they innervate. You've seen all those things that I've talked about are sensations. So when you have a migraine, it involves all those things. You can have all. It depends with the kind of disability, of inflammation or the problem that you are undergoing. You see. Welcome, my guys. I can't see someone saying it's my first time here. How can I? What do you do here? Tell me if it's your first time here. Yes. Tell me if your first time here. Let's interact. Let's get to know if it's your first time here. So you've seen. So when it comes to headaches and you have a migraine, which is primary headache, it involves all the it can involve all the 12 cranial nerves. And then you start vomiting, you start having problems with seeing, you start having problems with sensation, phonophobia, because if your tongue cannot move because the cranial nerve from your brain is being affected, what will happen? Problems when it comes to talking. So you see, a headache can make you lose even sensation. Just a normal headache. You have a headache and you are vomiting. You have a headache and you are not feeling any sensation because now you have and the trigeminal nerve is making your brain get massive inflammation. Your brain vessels, blood vessels are undergoing inflammation. You see, interesting, eh? So my guys, welcome to the chat. Let's talk slowly by slowly. Let's continue talking. Let's continue talking slowly by slowly. Let's get to interact. As we interact, as you come in, tell us where you are watching from. As we interact, tell us where you are watching from and where you are you appreciate where you are appreciating the content from. Today we are talking about something that is called, headaches. I said they are not just headaches. You are not just getting headaches. You are not just getting headaches. No, there are categories of headaches. And I started with migraines under primary headaches. I started with migraines because many people with chronic headaches, they say, I have migraines. So I wanted people to understand migraines so that you can calm down. Have you ever got chronic headaches? You yourself, how did you handle them? Now, there is this headache that is called tension type headache. Tension type headache. Tension type headache. Feeling your head as tension. Sometimes it is like something is pressuring the headache, like your head like this, pressuring. It's called tension type headache. It is the most primary headache disorder. Everyone that has a headache goes through this. You are feeling your head is like pressured inside. It is like throbbing like this inside. Throbbing and releasing. Throbbing and releasing. You see, it is called tension type headache. Tension. It is tight band. You feel like a tight band, pressure, squeezing and sensation around the head. And like migraines, migraines is migraines. It is usually not associated with this one, tension type. It is not usually associated with nausea and vomiting. You see, migraines is associated with nausea and vomiting. This one is not. You're feeling your head is like it is being pressed inside. Your head is being pressed inside. See, most common headaches worldwide, this one, tension. And you have seen people, just a minute, my friend, just a minute, I sent something. Yes, let's continue, friends. Yes, let's continue, friends. Let's continue. We are on tension type headaches. Tension type headaches that make your head feel pressured inside like this. The most headache that is worldwide, tension type. Everyone thinks when he has this, he has. If you are having headaches and the headaches are not involving vomiting, nausea, just know what you are having is not migraines. And tension type occurs at any age. It can occur at any age. Often associated with stress, anxiety, fatigue, and poor posture. Sometimes you lie at a very particular side, at a poor posture, and you feel the headache has come. Sometimes people may injure their neck and then they start feeling the headache is coming because you have been lying down at a poor posture. It's both men and women. You see, like the other one which was affecting, there is the other one which was affecting women, migraines, most in women. So this one affects more of, this one affects more of women than men. No, both. Migraines affect women more, but tension type affects both. You feel like your head is being compressed inside. You see, you can even touch it like this. Sometimes when you do like this down, your head wants to go down like this because of your headache. It is called tension type headache. How does it come? How does tension type headache? A headache is not just a headache. There must be something that is coming. The exact mechanism sometimes of headaches, it is called, but there is something that are called, you get pericranial, the muscles of that are on your head, increased tension and tenderness in the muscles. Now this one is when the muscles of your head are undergoing inflammation, something has injured them. Of the muscles of your neck, the muscles of head, something has injured them. Scalp, neck, shoulder, and jaws, even jaws. There are some muscles, I will name them like frontalis, temporalis, masseter, sternocleidomastoid, this one, sternocleidomastoid, trapezius, which is back. When it is undergoing a strain, you can start feeling the headache. Most of the people, when they have been working and you have been doing a lot of work, you have been working and you are doing a lot of work, and then you start feeling headache. These muscles are the ones which cause you to have a headache, because the inflammation, as it goes on, you feel this side, you feel the headache. It is called tension type. And when they are undergoing inflammation, you start feeling the real headache, pounding headache. Pounding headache. So you see the difference between this one and migraine. They are totally different. Tension type and migraines are headaches, but migraines, they come with nausea because of the involvement of the cranial nerves, the 12 cranial nerves. But this one, how it comes is it involves some muscles of around your muscles you've been working, straining, heat, solar, the sun has been hitting you, and then you start having the muscles starts to strain, the muscles of your head, muscles of your neck, frontalis, temporalis, masseter. The one that is here is called sternocleidomastoid. This one, sternocleidomastoid. So when you feel them, you start having headaches. Primary, trapezius, the bigger one, which is back, is called. So everyone who is watching, I can see you are good in my channel. Come to the chat, tell me where you are watching from as we discuss headaches, so that you will not be confused which drug one day to take, or sometimes even you don't need drugs. You saw when we are discussing migraines, we said taking a nap in a dark room is very important because of light sensitivity. So here let's learn what is tension type. Why do people get these headaches after they have worked? Because of the muscles involved. You have been working, you have not eaten well, you start having a problem. It means the muscles that are involved are having a problem. You see, there is something that is called central sensitization, increased sensitivity of pain in the brain and spinal cord, lower pain threshold. They explain chronic. So you have pain somewhere, and the spinal cord is increasing the sensitivity because there is a sensitivity of getting pain. The spinal cord and your muscles are sensitive to pain, so you start having the headaches. It is called central sensitization. Your central operating system is the brain and spinal cord. So when you are having central sensitivity to pain, to mediators of pain, there are some things that give you pain, like substance P, neurokinin A, and also something called prostaglandins. So when your spinal cord and your brain has the sensitivity to these substances, you start having a lot of headaches. You see, psychological factors is very important. Stress, anxiety, depression, emotional strain. Stress, anxiety, depression, and emotional strain. Emotional strain comes in when you are hurt emotionally. You understand? When you are hurt emotionally by a friend, family member, and someone, or you are undergoing something emotionally, you may get pain because you may get headaches because there are some substances, neurotransmitters in your brain that are not released, like serotonin. The other one is called serotonin. There are others that are called dopa, GABA. So suppression of this, and then you are releasing mediators of inflammation like prostaglandins. You start having a headache. This comes when you are depressed, anxiety, and also you have stress, anxiety, depression, and emotional strain. You see, so tension time headaches can this one can come to any person, a child, a grown up, an old person. This one can come to every person. So it is very important to know when you have chronic headaches, it doesn't mean you have migraines, because people confuse migraines with these headaches. Migraines, we have categorized them. If you didn't see that yesterday, we did migraines. Please go to that video of migraines and watch video on migraines, and you will appreciate. So these things like stress, anxiety, depression, and emotional strain can increase muscle tension and pain perception. When you are stressed, your muscles are also getting involved, and they get pain perception. Your brain has something that is called neurotransmitters, like serotonin, endorphins, and norepinephrine. So these ones, like serotonin, when it is released to your brain, you feel relaxed, you feel you are feeling good. But when you have pain or something is undergoing like stress, they are not released. So the drugs that you are given, like antidepressants, what they do, they just allow the receptors, the sites that are receiving the receptors of pain, to go to do what? To uptake more serotonin, so that you can calm down and feel nice. You check. So these are things that sometimes when you talk about headaches, you don't just take medication. Don't just take medication, because when you are taking medication for pain, let me say you messed up. You are undergoing psychological problems. Maybe you and your person, you have problems. Maybe you are mourning and you are taking painkillers and they are not working. It's because you are not dealing with what is supposed to be dealt with. Because let's talk about when you have stress issues. The thing that is supposed to make you relax and feel good, which is serotonin and dopamine, it is suppressed. It is not coming out. When serotonin and dopa is released, you may feel your pain has gone down. So wherever you feel headaches that are coming because you are stressed up and you are taking something like paracetamol, sometimes it may not work. There are some painkillers that when you take them, when you have a certain kind of stress, they will not work. You need something like antidepressant, and specifically something that is called serotonin receptor uptake agonist. Serotonin receptor uptake agonist. This one shows that when you increase the uptake of serotonin, you kind like relax, and the stress that your muscles and your brain is undergoing, it comes down. So you increase the reuptake of serotonin. But now When you are taking something that is called paracetamol, paracetamol stops prostaglandins, and your brain is not undergoing inflammation because of prostaglandins. The headache will not stop. And that's where people come in the hospital and say, Doc, Daktari, in Kenya we call Dr. Daktari. Daktari, I've been taking medicine. I've been taking painkillers and they are not working. Let's say something like, let's talk about something like this one is called migraines. Neurotrigeminal inflammation and excitation. The trigeminal nerve, this one. You remember, if you have not seen how these things are, go to the previous video and learn about it. Neurotrigeminal excitation, the nerve itself. Now, because you are taking painkillers like NSAIDs, anti-inflammatories, which they may help. They may help to release the inflammation of the nerves and the surrounding tissues. But now this person will continue vomiting. Why? Because as you release the inflammation, the excitation is still on and it's continuing to other nerves. So what do you need? You need antiemetics. Like metoclopramide, you call Placid, to stop the nausea. And also you need the serotonin reuptake agonist, so that it can enhance more serotonin to come out so that you can relax. There is a patient who came to me with some drugs and asked, Doctor, why have I gone to a hospital? I'm not depressed, and the doctor has given me antidepressants. I have Googled these drugs and they are antidepressants. Why is the doctor giving me an antidepressant? And I had to explain to this person that how they work and how everything goes on. You see, because these are antidepressants and they work in things that can make your headache go down. So as we talk about tension type, which is primary headache, let's get to know the risk factors. Who are at risk of getting these problems? Who are at risk of getting these problems? Fatigue, sleep deprivation, eye strain, all those, poor posture and neck strain, because many nerves come from your, psychological factors. We have talked about strain, depression, sleep, people are not sleeping, eye strain, all those. Lifestyle, some people may want to cut weight while they are skipping meals. Dehydration, excessive caffeine, alcohol use. So those are the risk factors. People who are taking drugs and alcohol can get this one, because dehydration also, lack of enough water, can cause you to have this problem. So tension type headache, it's just like migraines. Migraines are categorized into two. There are ones we categorize into FRC, my friend is here. FRC, welcome to the platform. Thanks for tuning in. We're talking about headaches. So tension type headache, just like migraines. Migraines is categorized as one, migraines without aura and migraines with aura. This one also has its categorization. FRC, hope you went through hydrocephalus. If you have a question, we did. I think that time you were busy. We did hydrocephalus, and I didn't see you. I think you were busy. You are the one who requested. I hope you went through it. If you have a question, you can ask about hydrocephalus. You can ask. We see where we can help. Classifications. Infrequent episodic tension type headache. Infrequent episodic. They are not frequent. They come with episodes, you know. You have headaches right now. After some time, you stay, you see the headache coming again. They are called infrequent episodes. Infrequent episodic. They are not like migraines that continue. They start gradually, and they become so intense. No, this one's, the first classification is infrequent episodic. Less than 1 day per month. Less than 1 day per month. Then in a month, without doing anything, you just feel an headache that is coming half a day and it disappears without you treating it. Fewer than 12 days per year. You are having headaches that are not explained, but you are feeling that your head is being throbbing and tight because of the muscles. Frequent episodic tension type headaches. The one was infrequent. It doesn't come so much. 1 day per month, that one is negligible. Sometimes people may ignore them. Less than 1 day, that one someone can ignore it. You get. But fewer than 12 days per month, per year, sorry. See, that one is infrequent. You can't even know that you have 10. Oh, you have rewatched. Thanks for rewatching it. Now, there is frequent one, which 1 to 14 days per month. That is like half a month. You are always having headaches. 1 to 14 days, like alternate, or 2 days come. Lasts for 3 months. For at least 3 months, you are having some headaches. This I'm talking about categories of tension type headaches. Categories of tension type headaches. You see how they come? Infrequent, frequent. Because if you are having a headache 14 days alternate in a month, that one is frequent. You will notice that something wrong is going with me. Something wrong is not good. Something is not good with me. Yeah? There is chronic tension type. 15 days or more. 15 days or more in a month. More than yet, whole of the month, you are always complaining about headaches. Whole of the month. It can last more than 15 months, than 3 months. It can last more than 3 months. So, classification of these headaches are classified into 3. It is classified in frequent episodic tension type. It is classified in frequent episodic tension type and chronic tension type, which is, I've given the time, 1 day per month infrequent, 1 to 14 days a month, that one is frequent. Chronic, more than 15 days in a month, that is like every day, like you can be having a headache. Every day you can be having a headache. So everyone who is tuning in right now, you are watching Benjamin the Wise Guy here. You're watching Benjamin the Wise Guy. That is my name, Benjamin the Wise Guy. Dr. Ben is my name. That is the channel name. If you are watching me right now, don't forget to hit the like button, my friend. I can see it's Joya. It's Joya. Do you get some headaches that come and then they disappear for themselves? Big up all the time. It's Joya. As I see you here, be blessed for coming to this channel. My channel is where we smile and then we feel good. So we are talking about normal headaches. We talked about migraines. So I know where it's hot. Qatar is hot. Qatar is Dr. Ben. Greetings to you. Thanks. It's Joy. I'm good. And I'm still taking my green tea. So Qatar is very hot. It's Joy. Do you have some headaches, or you are stone cold, stone cold, who always repels these things? You know, there are some people, no matter the environment they are in, you will never see these people saying, I have a headache. No matter the environment these people are in, you will never see them saying, I have a headache. So that is it, my friends. As we continue talking, let's continue interacting with everyone. I'm here but driving right now, Dr. Benjamin. In the life. Yes, I understand. Jamaican uncle is driving to somewhere, and he's in the background listening slowly. And remember, Jamaican uncle time trades that yesterday it was 7. So be checking on the time of Jamaican uncles if it is 9 or 2. 9 Kenyan time or 2 Georgia time. Check out. Sometimes when it's too hot, some people here get headaches. Yes, dehydration. So it's where I want you to know that the kind of they get is not a migraine, unless this person has a problem that is significantly affecting the person and is affecting the nerves and is vomiting. That is not migraine, it is tension type. Tension type that is classified into 3. I've classified them. So my friends and everyone who is watching here, what can make you check on and say that whatever I'm dealing with may be tension type? Tension type does not come like migraine sometimes, that comes sideways alone. Tension type does not come. You know, some people get one-sided headache. Tension type comes the whole headache unilaterally. It comes the whole headache. The whole headache. And mostly when it comes at the forehead, you know that this is not a migraine, this is tension type. And sometimes it comes at the back of the neck because of the muscles. You understand, this sternocleidomastoid muscle which is here, sternocleidomastoid, if this muscle is called that, this muscle may be getting, you may get pain here. And sometimes you may get the entire head. You see, this one is different from, it is different from the, what is called, it is different from migraines. So we can see the quality. The quality is very important. Dull ache, pressure, tightness, burn-like sensation. Oh, J. Hank from Thika is in the house. J. Hank, I have a special question for you. Do you get some headaches at times? Normally, I'm just asking people randomly. Do you get some headaches at times normally when you are at work? And you know, with tension type, sometimes you have dull ache, pressures, tightness, band-like sensation, and it feels like someone is squeezing the neck. Greetings, Jayhan. Greetings from where you are chilling from. Greetings, it's Chua. And Jayhan, Efasi, please let's try to interact about headaches. Let's try to help about headaches when someone feels headaches. Grand Rising, my brother, Dr. Ben and Chat. Welcome, Chat Travel. Thanks for tuning in. I know it's morning where you are, or maybe you are going to work, or you are at work. Chat Travels, I understand you nowadays I've started to understand the regions, and you know, When I started doing this on YouTube, I didn't understand the regions and time, but right now I kind of like understand. Like Sha Travels is at work. You see. So let's get to understand. Do you get chronic headaches? And Ischoya said where he is, Qatar, people get so much headaches at times. People get so much headaches, and I understand Qatar is so hot. So it's where you are, it's not migraines that you get. What you get are tension types headaches. Tension types headaches. You know, it feels like someone is squeezing my head. Have you ever felt a headache and then you feel like someone is squeezing your head? Yeah, sometimes you can feel a headache until you feel that someone is squeezing my head, and then you can like, when you do this, you can like feel better, but you see in your eyes, it's like your eyes are coming out. So the difference between migraines and tension type is migraine is unilateral, and it comes with vomiting, it comes with nausea, one-sided, but at times it can be both-sided, one-sided like this, and then it is categorized with migraines with aura and migraines without aura. Auras are the things that follow. You have a headache until you cannot see. You have a headache until you start vomiting. You have seen some ladies, when they have headaches, they vomit. They cannot even walk or talk. You know, I received one day a lady in hospital, and she was not talking. She was in headache. And the family was saying, this person is like making fun of us. Just a headache. How can a headache make a person not to talk? And I talked to them. I told them, no, it can make. These are migraines. So let's moderate them. Let's bring them down. She'll talk. So everyone who is in the chat, following and listening, big up and bless up. Sha Travels. It's Chwea, J Hank, Efasi Lipenga. Efasi, I'm still waiting for your questions. And everyone, Jamaican uncle, as you are driving, big up every time. You know, Jamaican uncle lives the Ford heavy machine, you know. Big up every time, Jamaican uncle. I'm waiting for my Jamaican uncle. You may be gone for a while, but I'm not. Sometimes I do get headaches, especially when I'm at work, because the heat system are always on. Yes, FRC, those are called tension types headaches, and you will see how to manage them. J Hank, I'm still waiting for my answer. Do you get headaches at times, J Hank? Do you get headaches at times? So these tension types may be mild to moderate, not usually severe. Sometimes are not. I drink plenty of water though. That is fine. FRC. When you are working at a place that is really hot and burning, you need some water. You need some water to rehydrate, so that you may not get these tension types. You see, all the loves from Sha Travels. Big up as you are at work. Be blessed and have the energy to continue and continue and continue. Have the energy. Now, let's talk about something that is called the duration. Because headaches have a duration. Sometimes you cannot just have headaches that have no duration. Mild photophobia, mild phonophobia, sound sensitive. Phonophobia, sound sensitive. Photophobia, sensitivity, light. Usually do not have vomiting, severe nausea, aura, neurological deficit. These ones, neurological deficits, I mean nerves, like seeing, sensations, and aura. Aura, I've said like flashy light, blind spots, things like those ones. So you will not see that have those things in this one. Those ones are in migraines. Those things that you feel, you see, you do what, those ones are seen in migraines. Those ones are in migraines. And in tension type, you may have mild photophobia and phonophobia, sound. You've seen some people when they are stressed up, they will come and tell you that when they get home, even you, when you get home, and your child, your partner, your friend has put a loud music, you'll tell that person, please bring down the music, I'm having a headache. That is called phonophobia. What causes headache and nose bleeding? Headache and nose bleeding, that is high blood pressure. That is high blood pressure, because when the blood pressure goes high, the little area capillaries may burst and you start having nose bleeding. You see, the features help to distinguish tension type and migraines. Migraines and this tension type: vomiting, severe nausea, aura, neurological defects. So there are some things that you look at and you know this person is undergoing tension type. This person is undergoing tension type. Like which ones? There are some things like tender scalp. If you touch a person here, a person says, I'm feeling pain. Don't touch, I'm feeling pain. Neck muscle, that is tightness in the neck muscle. Shoulder muscle tenderness. And why do a person feel shoulder muscle tenderness? The ninth cranial nerve. No, that is accessory. Accessory is the 11th cranial nerve. 11th, that helps you to do this. It comes from your brain. So when you have this muscle tightness, it affects that nerve when it's coming to help you to shrug your shoulders. You see, ninth cranial nerve. So neurological examination is very important. When I'm saying neurological examination, I'm simply saying examining the nerves, the 12 cranial nerves, and I've persistently gone through the 12 cranial nerves. I will name them again. These are the most important nerves. When these nerves are not working, then you can be a vegetable. You understand when I'm saying a vegetable? You are just there and your body is not innovating. From your brain, olfactory, optic, oculomotor, trochlear, trigemina, abducens, facial. And then we go to vestibulocochlear, the ears and balance, vestibulocochlear, glossopharyngeal, accessory nerve, and we go to vagus nerve. Vagus, accessory, and hypoglossal. Those are the main. They are the main. I usually go through them so that you may understand that these are very important factors of life. When you hear someone saying the nerves of your body are injured and someone cannot walk, the spinal nerves, the spinal cord nerves, that one is life-threatening when it comes to locomotion and innervation. But let me tell you one thing. When it comes to disability of the 12 cranial nerves, my friend, that is worse. 12 cranial nerves. The 12 cranial nerve is worse because they are the ones which help you to do things. And you see, when it comes to headaches, they are involved because they come from your brain and they calm. The vagus nerve drops up to the intestines, from the heart to the intestine. So if you are having a headache that is revolving like the tension type, all this, it means your head, everything that is involved is injured. So let's get to understand this. Let's get to understand this. Very important factors in life. Let's protect our head by our nutrition. Let's protect our head by what we are doing. Let me repeat the cranial nerve. And when I'm saying cranial nerves, it's not a big word. Cranial nerve means the cranium is the skull. The cranium is the skull, and it protects your brain. And in your brain, it arises some nerves. So if someone asks you, what is a nerve? You know, I like explaining to the... If I ask you what is a nerve, you need to be able to understand what I mean. A nerve is physical cold bundle of fibers in your body that carry messages. You know, nerves are fibers. Someone thinks nerves are just something. Nerves are fibers. They are like strings. If you check on a person, no coffee cakes, welcome. Let me find if I can see my this one. my hot water. We are talking about nerves. And where is this thing from? Yeah. I want to explain what a nerve is. So I was explaining a nerve. I'm talking about tension type headaches. Coffee cakes, welcome to the platform. Welcome to the platform. How is you where you are, coffee cakes? How is the going where you are? Hope you are doing good and everything is fine. Your kids are glowing and everything is going on well. So I'm explaining, I'm getting on the last one now. Oh yeah, the nerve. So coffee cakes, I was talking about the topic of today, tension type headache. And it is not like migraine, no. So a nerve is, they are sometimes white. Go with dog, I'm back. Nice. Coffee cakes, we have a new friend from Indonesia called Gofi Nico the God from Indonesia. Nice guy. Nice guy. We get this cable here. So my friends, nerves are like this cable, the white cable. You see how it is looking? Nerves in your bodies are like this. You can push them. You can push them when you are looking at someone and you are examining a person. A nerve is something that you can touch. And these nerves, they come like the one I've drawn. Imagine something like this. Where is this cable? Let me get this cable. Yes. Imagine something like this arising from your brain. Those are called nerves. Nerves. Someone may ask, what is a nerve? It is a physical cord-like bundle of fibers, just like how wires pass in an electronic gadget, how wires are connected. Even nerves are like that. They are like that, cables like these bundles, but they pass information, carry messages between the brain and other organs. Those are nerves. You see, very interesting, yes? So when I'm talking about olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial nerve, number 7. You see, vestibulocochlear, number 8. Number 9, which is the number 9, which is glossopharyngeal. They start from here. Olfactory comes in, drops to the nose. Optic comes down to the something called optic. They are like these things, and they pass through the sinuses inside. they come to the eye. Oculomotor, it comes and it attaches to the muscle of the eye. Trochlea comes and attaches to the muscle of this eye. Abducens, eye movement, it comes and attaches to the muscle of the eye. Those like thin rubber bands. Yes, like thin rubber bands. If I cut your hand, I can be able to show you something like this. That is a nerve. But now when we talk about tension type headaches, we are talking about these things that are being irritated by something. You get? You have worked so much through the day and you are getting tension type headaches. You have worked so hard through the day and you are getting tension type headaches. What does it mean? It means that the nerves are irritated. But the difference between tension type headache, you know, we said we have 4 types of primary headaches, that they are like the disease themselves. Tell me which one? The nerves have complicated names, eh? Okay, let me go slowly. Emphasis is saying the biological names. Let me go slowly on the nerves so that I can go and differentiate this one and my one is called olfactory. Olfactory is smelling. Smell. So it was named after olfactory smell. When you go and see an optician, on ophthalmologist, it means those guys just got their names from their work. Optic, remember the eye, seeing, Oculomotor. Motor means, that is the third one. Motor means muscles. Oculi means the eye. Optic, oculi means the eye. So it means the third cranial nerves works on the muscles of the eye. Trochlea, eye movement, the same as optic. Yes, these things are not hard. Trigeminal nerve, this nerve here that has 3 branches, ophthalmic, maxillary, and mandibular. Ophthalmic for eye, maxillary for here, the maxillary region, and the mandibular for mandible, the jaw. So don't worry yourself, you just understand these facts. If you are being, you see the terms are very complicated, just ask me, Doc, this term I feel is very complicated. What does it mean? You see? So let's go. And but I'm sure someone knows migraines a lot. Migraines, it's a medical term that everyone says, I have migraines. Every time a person says, I have migraines, you are having headaches and you are vomiting, you are having nausea, light sensitivity. Why? Because this nerve is irritating ophthalmic, maxillary, and mandible, and it is irritating even the others cranial nerves. So I've said, when I say cranial nerves, you understand I'm saying the skull. Medical name for the skull is the cranium, the skull. But we say that the cranial nerve because your brain is inside the skull. So if your brain is inside the skull and they say cranial nerves, you quickly understand that the nerves that are inside the cranium. You see that? Very important thing. Very important, and very important to digest slowly and slowly. That's why I'm not going so fast. I want people to understand what headaches are. So if you are watching and you're a new person in the channel, don't forget to tell us where you are watching from. Like our new friend Kofi Nico from Indonesia. Big up all the time. Big up the coffee cakes. Big up FRC. Big up Jamaican uncle. Big up everyone who is watching. Big up everyone who is watching. Sha Travels at work. J Hank 47. Yes, Outer Thika. I know this is the time that J Hank at times is very busy with the work that he's doing. Chwea from Qatar. Nene and Mom. All of you. Big up. Let's get what is called tension type. So the difference is in tension type you don't have nausea and vomiting, but in migraines you have photophobia. You may have, you may not have. Tension type may come the whole head, but migraines is unilateral, one side. Migraine is when you are feeling just one side is really pounding. And tension type is different from migraine because migraine is throbbing. Tension type is, it feels like a rubber band or a band is tightening your head, tightening as it's releasing. You see, that's why it was called tension type, headache. Now, how can you know that you have tension type? Let me take a sip of green tea. How can you know that you have tension type? The headaches go from 30 minutes to 7 days. Imagine 30 minutes to 7 days. 30 minutes to 7 days. Bilateral. Bilateral means side by side. It affects you side by side. And I've said it is pressing and tightening you. Pressing and tightening. And it is mild to moderate. Start slowly, graduates slowly, gradual to not aggravated by routine activity. But there is no nausea and vomiting. No more than one photophobia or phonophobia. Photophobia is irritation from sound. I know as you watch, you are now appreciating. You have been saying that I'm having headaches that are migraines. You are now appreciating what migraines are. You are now getting to know what I mean when I mean you have migraines. So let's get the difference straight. The tension type and the migraines type, because most of the time they seem the same. Tension type and migraines. Migraines, most of the time you feel your head pounding on one side, and sometimes you can see someone doing like this. Tension type is bilateral. Bilateral means both sides are affected. So quality, how it happens, how it happens. Migraines are throbbing, you feel. But tension type is tightening, you feel it is tightening and then it is releasing. It is tightening and then it is releasing. Sometimes in tension type you may not get nausea and vomiting. Vomiting is absent. In tension type you will not. But in migraines you will see someone vomiting. Sometimes when you work, when you are working in tension type, it will maintain. The headache will not go on and grow, no. But in migraine, if you try to work, it grows, because now when you are working, you are irritating the nerves. You are kind of like irritating the nerve. So so this trigeminal nerve, because I'm using this, let me name it. Trigeminal nerve, trigeminal. Trigeminal nerve, this one. It gets irritated and it produces substance P. It produces neurokinin A. So can they appear behind the head, above the skull, meets the spine? Yes, and that is a classical coffee cakes. Whatever you have just said is a classical feature of tension type, not migraine. My tension types can here, you see, and the spine here, because it is the muscles are under tension, and you have muscles here, see, and the neck. That's why it was called tension type. You have just talked about tension type with what you have said. That is tension type. That is real tension type. So, sinus, the sinus headache, facial pain, sinus here, nasal congestion, and fever. That is sinus headache. And it comes because of olfactory nerve that is irritating the brain. Cluster headache, several unilateral pain, eye redness. So most of these headaches, when you have them, we do first something that is medical or clinical review. Ask questions and ask you where you are getting the pain. Ask you where the pain is. Where you are feeling, is it one-sided? They guide the doctor on which nerves. Which nerves are affected? You know, when you tell the doctor, I'm feeling pain this side, it will guide the doctor on which nerve is being irritated. Very important and very specific. Clinical and medical examination by inspecting the person, asking the questions. And also sometimes you feel, because some headaches you can see, like tension type, when you touch like this, you'll feel the tension itself. Sudden severe headaches, sometimes they just come suddenly and they become severe suddenly, and they become so severe. Neurological signs. When I'm saying neurological signs, I've named the 12 cranial nerves: olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, glossopharyngeal. All those that I've named, the 12 cranial, the 12 cranial nerves, glossopharyngeal, vestibulocochlear, all those vestibulocochlear that I've named. We examine them. How can we examine this one? I will tell you, I'll take something that is like spirit and pour it down and ask you, what are you smelling? If someone tells you nothing, you just know the first cranial nerve here affected, and you will see that person having a problem at the frontal cortex. Even the headache is here. Optic. There are three: optic, olfactory. So optic, oculomotor, trochlear, the three. These ones that are involved in eye. So if this person have problems with flashlights, you take a light and then you do this, and this person does this. Or you are trying to tell this person, can you open your eyes well? This person is not opening well, is doing this. you know that the optic nerve is disturbed, trochlear nerve is disturbed. You see, and the three nerves that are involved in managing the eye movement and balancing, optic, oculomotor, and trochlear, have a problem. And when you have a problem, this one may be unilateral. It may be pounding from these sides, from the optic chiasma where the nerves are connected here of the eye. You see how we examine someone. But remember, the sixth cranial nerve, which is abducens, also comes to the eye movement. So you may find that this eye cannot turn like this. This eye cannot turn because this person has a headache, and the degree of injury at the specific location of injury, this person has a problem there. So you'll see, if you tell this person, follow this hand like this, he cannot, he's doing like, you see, because the sixth cranial nerve, which is abducens, balances the eye by innervating something that is called hypotenuse lateral rectus muscle. Lateral rectus, lateral side, rectus, standing. Tension, it makes this eye to be where it is. But now, if you cannot be able to follow this eye like this, it means the lateral rectus cranial nerve number 6 has a problem, and it is giving you the headache. We examine number 7, the facial nerve. What does the facial expression and test? You can tell this person, can you try to smile, please? This person cannot smile. You see, I'm smiling. Whatever that is helping me is the facial nerve. So smiling becomes a problem, and this person is in tension type headaches, cannot. Even if you do what, this person cannot smile. We know that the facial nerve number 7, and then there is another thing that the facial nerve does. Test from the tip to 2/3 of your tongue. Taste when you take like sugar or tea, and then it is the one which is sensing sensation to the facial nerve, 2/3 to the brain, saying that thing is sweet or delicious. So it interprets. So when I give you something like sugar taste, and then you are telling me I'm feeling nothing, it is like salt, and you are having like a pounding headache, I'll know the degree of distraction. Have you ever seen someone that has a headache until this person cannot walk straight? Sometimes they walk like this. It is because of the nerve that is called vestibulocochlear, the nerve that comes and balances your ears. So we have another nerve that is called number 9, which is called glossopharyngeal. Glossopharyngeal. Now, the 1/3 that the facial has not innervated, it innervates, but sometimes it helps in swallowing. May have a person who has a headache, and this headache is making even this person, when this person wants to swallow something, it's doing because the innervation is not there. The irritation has gone to irritate glossopharyngeal swallowing. But you have always seen something that is called a headache with a lot of cough, and your heart is beating so fast, and you cannot speak. Vagus nerve. That's why it was called vagus nerve. It innervates everywhere, parasympathetic control of the heart, swallowing, and voice. Number 10, you have seen someone that has a headache and cannot even, is stiff, cannot even do this. Very stiff. What does it mean? It means that the accessory spinal nerve that comes to the shoulders and the back is affected. I'm just examining someone, whatever I'm saying is I'm examining. Hypoglossal. Person has a bad headache and even a tongue cannot. You tell that person, please can you show me your tongue? He does or she does. Can you take out your tongue? Because the last cranial nerve, number 12, has a problem. Examination when you come to a doctor's office is very important. It's very important. Examination. So that you can know which part is affected, my friends. And you start managing this person accordingly. After you examined, you have known that this is tension type headache. There are several things you can do without giving drugs. There are several things you can do without giving drugs, which are very important. Relaxation exercises, meditation. These ones help the serotonin and dopamine to come out, to relax neurotransmitters of your brain. Deep breathing, relax. Don't stress yourself. Don't stress yourself. Take a deep breath and keep quiet. Sometimes when you have tension type headaches, keep quiet. Take a deep breath. Feel the headache and try to calm yourself down. Let the serotonin of your brain come out so that they can be uptaken by the receptors in your brain. When they are being uptaken by the receptors in your brain, when they are being uptaken by the you get serotonin helps you to calm down. Get out of bright light, get out of noise. More noise. I can see Celine Isaac is here. Celine Isaac, welcome to the chat. Thank you for tuning in. Remember to hit a like button, Celine Isaac. So when you relax, when you are in a noisy place and bright lights, Queen is in the house. Thank you, Queen. When you are in a noisy place with bright lights, it is stressing the brain, and the neurotransmitter that is called serotonin cannot come out. Neurotransmitter are those things, chemicals that are produced by your brain to balance the stress and tensions, to make you feel good. So when you have this tension type headache, I've said, what do? Get out of bright lights, get out of noisy place, relax, meditate, that it may enable the serotonin slowly to come out, and the receptors which are receiving the serotonin to open up to receive more serotonin, so that you can calm down. And when you are calming down and the serotonin is working, the inflammatory part of your nerves is coming down. The inflammation, the releasing of sensitivities, the mediators are going out. You get? This is how, I can see cute Jassy in the house. I can see Smiler in the city. Hi, Dr. Benjamin. Glad to see you today. Thanks so much. We are talking about headaches, and these are tension time. If you are coming late, please rewatch. And I'm talking about neurotransmitters. How neurotransmitters help you to relax. Sometimes it's not a must that you take drugs when you have headaches. Calm down. Relaxation exercise, meditation, deep breath. You have seen how monks do it. Do you know what it does? It helps the neurotransmitters like DOPA and serotonin to come out, to relax your body. The inflammation of the nerves and the brain parenchyma to reduce, and then the headache goes out naturally. Headaches go out naturally without, you got lifestyle changes. If you are straining yourself a lot, sleeping, waking up early, take some rehydration, oral rehydration salts. Regular meals. Hydration is very important, and exercise. You see that? Very important. These are the tricks if you have been having tension type headache to relax, my friends. You feel it? You feel relaxation, rehydration. Hit the like button, my friend. Big up Cute Jesse, big up Smiler in the City, big up Celine Isaac, FRC, Jamaican Uncle, Coffee Cakes, Share Travels where you are watching, listening, Queen in the house saying blessings everyone. Hit the like button and let's increase the impressions. Let's get to increase the impressions, my friend. There are physical therapies like neck stretching, posture correction, and massage therapy. Massage therapy, although a person like me with massage, no. But there are people who love massage. My body is so sensitive. A massage, I keep on laughing. If you do massage to me, it will be a game of cats and, and mice. You'll be touching me, I say, ow, ow. Now, paracetamol 500 to 1000 milligrams. If relaxation techniques is not trying to help, you have tried to lie down and everything is not working, you can take paracetamol 500 to 1000 milligrams, brufen, diclofenac, and they are called non-steroidal anti-inflammatory drugs. Please don't take brufen, naproxen, and diclofenac when you have acidity issues. It will increase the. You can take paracetamol. And then, because we have talked about neurotransmitters like serotonin and DOPA, what you do, you take some antidepressants if it is chronic, and alternatives like norepinephrine and serotonin inhibitors. They will help the neurotransmitters in your brain to come out so that you can relax and the tension. And that's why when you go to a hospital, some doctors will give you antidepressants, and someone will ask the doctor, do you think I'm depressed? Why are you giving me antidepressants? I googled and I saw these are antidepressants. Then the doctor will just keep quiet, or a good doctor will try to explain. So it is not every time that we give these drugs, it is because we are giving because you are having depression. No, we are increasing some release of neurotransmitters so that the headache can, negative feedback. It is called negative feedback. You release some things and then the other thing that is causing the headache calm down. So don't go home cursing the doctor. The doctor has given you antidepressants and you are not having depression. It's very important. Sometimes before cursing any doctor, it is good to be seeking an explanation. One day I visited a hospital. I was not working in that hospital, and Because I'm a doctor, I walk majestically in a hospital and I know which offices. It was at night at 8, at 9. I walk majestically, I talk to nurses in a great way. I come out, you can think that doctor is working in this hospital. So, after I come out, I'm going out, a lady follows me. And as you work in this hospital, hey guys, sorry about that. I don't know who is calling. Yes, sorry about that. Someone was calling. I work in this hospital and someone is asking, you work in this hospital. I've been here for like 1 hour and no one is looking at me. No one is. I asked the lady, it's at night and I'm sure everyone might be busy. Maybe I find someone who can help. The lady was demanding to see a pediatrician. At night. And most of the special clinics are there in the daytime. So I tell this patient that it's good you seek a first aid, then you come tomorrow. The patient went well. I'm not a doctor in this hospital, so I cannot start practicing. It's at night. Went while cursing us, plus the nurse. Hey, then you go home, you get headaches. My friend. Funny. So these are kind of things that are with you get when you have just a minute. Please don't move. Let me give a directive. A minute, I'll be here. That was less than a minute, my friend. That was less than a minute. So I've given my directive and it's done. You see. Now, complications. Let's go to complications as I finish this. Complications of tension headaches. Because you are used to headaches and then you are taking NSAIDs, combined analgesics and paracetamol. You know, combined analgesics are like drugs that have 3 drugs in them. You can find a drug has a muscle relaxant, a drug has NSAID, and a drug has paracetamol, anti-inflammatory, and acetaminophen. So whatever that is in that drug, the NSAID, if you have acidity, what will happen? You will start having ulceration, stomach pain. So if you are coming in right now and you are new to the chapter, you are new to this platform, please hit the like button and don't go without subscribing. Some new people always tell me, I've been watching your channel every time, but sometimes I don't know what time you are coming online. I'll be glad to be following you. I ask the person, have you subscribed? Because if you have subscribed and you have hit the notification, it will be telling you what times I'm on. So if you are following and you feel I need to be following this channel, it's an educative channel, hit the like button, subscribe, please don't swipe away, subscribe to the channel, hit the like button, subscribe to the channel, and come to the chat, tell us I'm watching this country and I'm watching from this country, and we will appreciate. Some people meet here and they get help. Some people meet at my channel and they fall in love, and serotonin comes out, stress goes away. some people come here and they get some help in another way, you know. So tell us where you're watching from. Don't be shy to tell us where you are. Don't be shy to tell us which country you are living. Maybe you are there and your next neighbor is here watching and you don't know. So complications, overuse of head medication is not good. If you have a transient pain headache of 1 month, please let the doctor deal with it. Stop over-the-counter medication. You may start another problem that may arise from what you are having. You may start having ulcerations, drug toxicity, liver enzymes going up because you are used to, and then addiction of analgesics, and addiction of drugs of reducing pain. It's not a good thing. You may start to have the addiction. You see? So, guys, when you're watching this channel, learn something. If you have been using drugs, analgesics every time because of pain, and also your doctor is the one who is inducing, giving you every time analgesics because of a pain, find a good person to manage the pain. Find a good person to manage the pain. Reduce quality of life. Painkillers can reduce quality of life because sleep disturbance, poor concentration, and reduce productivity. Liver enzymes going up, destruction of some things in your body, not good. Now, how can we prevent, as I'm ending this session? If you have a question, please ask. Please ask that. I'm ending by, we have been talking about tension type headaches, and if you want to manage them, manage stress effectively, maintain regular sleep pattern, exercise regularly, avoid prolonged sleep time, correct postures. We have talked about all this. Avoid overuse of killers. Avoid overuse of painkillers. Limit excessive caffeine. For those who like coffee cakes, you hear that? Limit excessive caffeine for those who like caffeine. Avoid watching too much. You may get inflammation of the nerve. I've really talked about the cranial nerves. So anyone with a question, we have and there is something that I want to say. Tension type. Tension band sensation. It's like a band is tension in you. Emotional stress trigger. Emotions. And neurological deficit. I'm still here at my location and waiting. Oh, okay, uncle. Scalp tenderness. You feel muscles and you feel pain. Improves with rest. Often bilateral. No nausea and vomiting. That one is for migraine. Remember those. Those are the characteristics of tension type headaches. Tension type headache. So any question, anyone who has any question here, anyone who has any question, please. Before tomorrow we will be dealing with another type of headache. We have done migraines, tension type. These are primary headaches. Tomorrow we will do cluster headaches. Cluster headaches are other types of headaches. Cluster headaches are other types of headaches. Cluster headaches. Chacharaz is just coming in. Chacharaz, did you communicate to me? Quincy told me to talk to you. Did you communicate to me? I'm doing fine. I've been waiting for your communication. I've not found any. Hope you will. Yes, I texted you. Okay. Now, tell me. I have so many texts. Please tell me I'm Chacharaz. I have over 500 text messages, Chacharaz, and my phone sometimes asks. Okay, you text me, tell me I'm Chacharaz. I was finding you because I wanted ABCD. Please do that. I will see because you are searching for me because of something and I want to know. Please text me again. Tell me this is my number. I'm Chacharaz. I have so many texts so that I can know. This is what I wanted. I saw that you did sending greetings to me. Sorry, I couldn't answer because I was driving. Oh yes, Jamaican uncle was driving. So uncle, today we have talked about tension type, and everyone is appreciating now. I know someone will not come here to say every time I have migraines. No, now let's try to appreciate what migraines are and this other type. Please let's appreciate. Who is coming in right now and has a question on headaches? If you are coming in right now and you have a question of headaches, please hit the chat. If you are a new person, hope you have subscribed to the channel and you're doing good. FRC is still here. FRC, how did you find our presentation of hydrocephalus? How did you find our presentation of hydrocephalus? Hope it was okay. Hope it was fine. And let's continue to like. I can see more people are coming in. Let's continue to like. Jamaican uncle, big up every time from Cute Jess. You know, when I've finished a topic, I'm just sitting around. It means that I'm talking to my people now. I'm talking to the new people, and it's time for mingling and talking and asking questions. So everyone who is watching and is here is feeling the vibe and giving me those flowers. Thanks for you do that. Thanks for you doing that. Hello, look alike. Dorothy Gay, if you are watching, I've seen your text. Hello, look alike. Yes, I've seen your text. So anyone who is watching and you have today, you are so calm. No questions, no talks, you know. It's a Wednesday. It's a Wednesday. If it would be Friday, I could give you some time, some vibes, you know, some vibes to feel good as we talk. As we talk. So anyone who is having some questions, it's your time. It's your time to not even questions, to say something and share your for those that have channels. It's your time even to share your channel. You share your channel so that we can understand what you do in your channel. People have channels, but they don't like sharing their channels. And this is the platform you can share. Someone who will come to watch will follow it. And that person will appreciate your work. Content creation out here is not a joke. People do a lot to do content creation. People finance their content. People do things like a person who is coming in Africa from the US doing content. You see that it's financing. That person is financing. And when you come and you are not sharing as your channel here, you see, we may not be able to help you so much. But if you share your channel and say, I'm a new person here, please let me do what? Let me share this so that you can even see what I'm doing. You may be doing something so great. Something so great. Yeah? So you come share your channel. Let's have the interaction, the social interaction, and the interaction that is viable and with integrity. You see, I can see Jamaican Uncle as a channel. Let me start sharing for Jamaican Uncle. Let me start sharing. Uncle told me I'm having a problem with sharing my channel. Let me see if I can share your channel. Let me see. Subscribe more. Yes, cute Jesse has pinned the channel. No, the Jamaican Uncle is coming. I want to share all the channels, and maybe someone will watch and then will follow and will tell you I have just come. Great topic. Yes, Queen. Great topic. Let me share Queen's channel. Let me share Queen's channel. After this that you have watched, you will see after 2 days this one has hit 500 or 300 people watching. So when it comes to that, where is this? Okay, Queen Mullins, YouTube. Let me see. How comes I'm not getting the link of Queen? Oh, you have edited your link. That's why. When you edit this link, I cannot get it straight. Queen, you have edited your link. That's why it is hard to get you. But let me just post the link here that is not having you, but it will find you here. So Queen, that's your link. Anyone who wants me to post the link, tell me. Anyone who wants me to post the link, you tell me. Cute Jesse, Queen, coffee cakes. Let me go to coffee cakes. Coffee cakes has not edited. Let me pin coffee cakes channel here. So I'm waiting for your question as I'm posting some channels here. And if you can post for yourself, good. If you can post for yourself, please post those links. Please. Share Travels is here. Let me post Share Travels link. Let me post Share Travels link. Let me post Share Travels link. Let me see more. Share Travels yours is here. Let me post your link, so that when people are coming, I have seen students coming in and following, and even some health practitioners, and telling me you are doing a great job. So when they see your channels, they can follow, and they can appreciate what everyone is doing. Jay Hank. Let me post Jay Hank's channel. Go to channel. As I'm posting channel, if you have a question that you have, please bring it up. Ask that question. Let me see all those that have been in the chat posting your channels. I'm posting your channels. All those that have been in the chat. But if you can post for yourself, good. You can help me. Jay Hank, that is yours. Chwea, let me see. It's Chwea. Chwea is here. Let me go to Chwea. Chwea has a channel. Let me see. It's Chwea. Chwea has a channel here. Let me post your channel. I'm posting everyone's channel. Who has been in the chat? Thank you, Dr. Benjamin. Thank you, Jamaican Uncle. All these channels, let me post them. Everyone that has been in the chat and has a channel, if I forget, please tell me. Nene and Mom. Nene and Mom has been in the chat. Let me post Nene and Mom's channel. Hope someone will watch and will start going through those channels. Nene and Mom. Nene and Mom is here. Let me post Nene and Mom's channel. So I've posted everyone that has been in the chat. Hope I'm not forgetting anyone. Hope I'm not forgetting anyone on the chat. I want everyone to grow. And something that I want to address is when I'm doing my Feel Good Friday, there are some tools I use and some things I use for copyright. So if you don't know how to use them, please don't copy me. I don't want your channels to be striked down. When you meet me one day, you ask me what I do, I'll show you. But I don't want anyone to be striked down because of copyright. For me, I love music, you understand? And when I'm loving music and I'm with my people, I'll always give my people music. Oh, Smiler in the City was here. Smiler in the City, are you still here? I've not posted Smiler in the City. Let me see. Where are you, Smiler in the City? Oh, see here. So don't play music saying Dr. Ben plays music and is not given a strike. You see, those are my 1, 2, 3 things, you know, what we do. Smiler in the City. Smiler in the City, yes, your YouTube channel. When you are editing your YouTube links, please don't edit until you edit your link of YouTube, your link of the YouTube channel. Some people have edited until they have edited their link. So posting and following you becomes a problem. Don't post until you are posting. Smiler in the City, I've posted your link. Chat Travels, everyone that has been in the chat, I've posted your link. So today people does not have people don't have a lot of questions. I can see they are watching while they are appreciating as I'm posting their links. Very good. If you grow big. You grow big. I want every person to know my friends and to relate with you wherever you are at good capacity, you know. To relate with you at good capacity. So anyone who is coming in and is a new person, don't go without liking the video. The liking of the video can give you more impressions to this platform. So guys, let's see this one. What is a comment? Let's see the yeah. If a person comments to you a good thing, you have to reply, because you feel good, you feel nice, you feel better. So guys, we have had a good time. We have had a bit of 2 hours of talking, of tension type headache. Let's have another hours. If we can tonight, we will come and answer the questions, but if we will not, tomorrow is another day. I usually request you guys to share my videos, because these videos can help someone where he is or she is. Sharing helps this. Like now we have known the difference between migraines and tension types, and the people say that people get migraines and they don't know what migraines are. So blessings to you everyone, where you are chilling, where you are relaxing, where everyone is. I thank you for your presence, and at times you buy the what is it called, membership. Buy the membership to see more good videos and some good things there in the membership. There you will enjoy the membership and you'll feel good. And you will feel nice. So my time is up, my friends. 2 hours. Be blessed everyone wherever you are, and let's meet at night 10 or tomorrow as we discuss more issues. So tomorrow we will discuss about cluster headaches. Be prepared to get to know another type of headache, which is primary headache, and it is called cluster headaches. Enjoy, and if you've come late, rewatch and watch other videos. Don't skip ads, like the videos. Subscribe always to the channel. Bye bye. See you guys.